And thank you so much for joining us this Thursday for our COVID-19 press briefing. Today, Orange County Mayor Jerry O. Demings will discuss the progress of vaccinations and our vaccination sites, a milestone denoting some progress here in Orange County, and more as it relates to vaccinations. The mayor will also discuss new details on our emergency rental assistance program and tell you about our collaboration with partners to combat food insecurity. Orlando Mayor Buddy Dyer is here to discuss business assistance efforts and supporting local arts groups in the city of Orlando. And of course, Dr. Raul Pino is here from the Florida Department of Health to also discuss important details regarding infection rates and state vaccinations. We will begin as usual with Mayor Demings. Mayor?
All right, thank you, Dr. Williamson. Thank you to all of you for being here as we approach this holiday weekend, this Easter weekend. We have a lot going on, and I can tell you that we feel pretty good about where we are with the number of vaccinations occurring within our community. I was on an intergovernmental affairs conference call with White House personnel just prior to this event, and they shared that the president's new goal is to ensure that when he reaches that 100th day in office, that not only are they've doubled the goal from 100 million people vaccinated within 100 days to 200 million people. In order to reach that, that means that by the end of this month, that 100th day in office for the Biden administration will occur. So the supply of vaccine will be increasing significantly within the remainder of this month, and it is April 1st, of course, but this is really true, what they have said to us, okay? So where we are as a community here within Orange County, the vaccinations have really increased significantly. The convention center has distributed 175,000 doses of the vaccine, while the FEMA Valencia College's West Campus site has surpassed 100,000. And really yesterday, here within Orange County, we surpassed the 500,000 mark of individuals who have received at least one shot in Orange County. And Dr. Pino will talk more about where we are with the data momentarily, but I will share with you that 21.5% of Orange County's total population has had at least one dose of the COVID-19 vaccine. 43.6% of Orange County's population that is 40 years of age or older has received at least one dose of the vaccine, and that's good news. As we enter this Easter weekend, it's also a continuation of spring break. So earlier today, I received some information from our airport. They are projecting the air passenger travel to be up significantly compared to last year. Remember last year we hit rock bottom and we had some 12,000 plus passengers that went through the airport during that particular weekend. But for this upcoming weekend, they have projected, I think, over 200,000 combined over the weekend will be traveling through our airport. So that's indeed good news, but of course when people are coming in, they bring other things with them as they come in, and Dr. Pino and the epidemiologists talk often about the number of variants and other things that potentially can come in. So it remains very important to our community that we continue to wear the facial coverings and do all of those things that we have been asking people to do now for an extended period of time. On Monday, the state is opening up the COVID-19 shot to new Floridians ages 18 and older. In addition, 16 and 17-year-olds can also qualify for the vaccine under certain restrictions. The 16 and 17-year-olds must have a parent or guardian's consent, and that parent or guardian must be present at the time of the 16 or 17-year-old's vaccination. If a youth has been emancipated, meaning that they have been determined through the courts, even though they may be under the age of 18, to have the same status as an adult, they must show proof of the emancipation status. The youth or the group that will be receiving the vaccine will be receiving Pfizer. Is that right, Dr. Pino? They will be receiving Pfizer, so these young people will not be able to get vaccinated with Johnson & Johnson or Moderna. They will only be receiving the Pfizer. It is suggested that parents take identification, certainly for the parents, but also for the youth as well, just to clear up any concerns or discrepancies that could occur. We know demand is high with the lowering of the age of the shots within our community. The Advent Health site, for example, offered 3,500 appointments this week, and all were filled within the first 24 hours that they opened it up. With eligibility expanding on Monday, I'm happy to announce that the Convention Center appointment portal will open at 9 a.m. tomorrow, Friday, April the 2nd, and we will be offering roughly 8,000 appointments. We realize that it is Good Friday. So in anticipation of Friday's portal opening for the Convention Center, I would urge anyone interested in getting a shot to go to the CDR McGuire website and pre-register. By doing so, you will be assigned an account with information, and perhaps that will expedite the process when it opens up for appointments on Monday. Okay, you can get information about all of what I just said by going to our website at ocfl.net/vaccine for more information. The FEMA site operated at Valencia West Campus remains open 7 days per week from 7 a.m. to 7 p.m. In addition, the South Branch Library, the FEMA site, is open daily between the hours of 9 a.m. to 5 p.m. Both of these FEMA sites will be open on Easter Sunday. No appointments are necessary at either of the sites. The federally sponsored or supported sites will run through May the 26th and will be administering 3,000 doses of Pfizer vaccine each day. And now I'll update you on the numbers. Since the start of the pandemic, we have a reported 124,000+ cases of positive COVID-19 within Orange County. Our 14-day positivity rate is 6.1%, and again, Dr. Pino will highlight some particulars with that in just a few moments. 1,189 residents have died from the coronavirus. That's 6 additional deaths since Monday. We continue to hold all of the families who have been touched by the pandemic and with the way of deaths of testing positive in our hearts and prayers. Recently, the Center for Disease Control extended its moratorium on evictions to June the 30th of this year. Residents must be proactive and file the necessary paperwork with their landlord for the federal program, as they do not automatically qualify for eviction protection. You can get information on our website about this at ocfl.net/housing FAQs. There's a list of frequently asked questions and responses to those questions with additional resources there. Orange County's Emergency Rental Assistance Program is available to residents who are past due in rent and as a result have related hardships. The program may be able to provide up to $10,000 or 12 months of past due rent. So we still encourage the residents of Orange County to take advantage. Now, in order to be eligible for the county's funds, you must live in unincorporated Orange County, in the city of Apopka, Bay Lake, Belle Isle, Eatonville, Edgewood, Lake Buena Vista, Oakland, Ocoee, Windermere, Winter Garden, and Winter Park to be eligible. The only municipality in Orange County I left out was the city of Orlando. And Mayor Dyer will talk about the city's rental assistance program. And now, I want to kind of transition. There's a photo that's going to come up behind me. We're going to talk about an event we participated in yesterday with Second Harvest. The pandemic is far from over, but it really speaks to the food insecurity challenges that we have as a community. Due to the need for food assistance over the past year, Second Harvest Food Bank outgrew its existing kitchen and had to find an additional location. We had the pleasure yesterday of participating in their grand opening of the second kitchen on Mercy Drive called the Mercy Kitchen. This facility helps produce more than 115,000 meals each week, and much of that has been funded by the Orange County CARES funding. Last year, the County Commission allocated $8 million to Second Harvest through the CARES Act funding to assist with the hunger relief and food distribution efforts within our county. Through the CARES funding, Second Harvest was able to receive approximately $652,000 to construct the new kitchen, the Mercy Kitchen. The need in our community remains great regarding food insecurity as we continue to dig out of the hole related to the pandemic. So if you need assistance with, if you have a community-based project that you're working on where you need food supplies, I would encourage you to partner with Second Harvest on food distribution. And finally, this coming Easter Sunday, I would like to announce that our convention center testing site will not be open, and nor will the Barnett Park site. Our staff has been doing yeoman's work 7 days a week, so this Easter Sunday for testing, the Barnett site and the convention center site will be closed. With that, I'm going to turn it over to Dr. Correction. Well, I guess I could say Dr. Mayor Dyer, since he has a Juris Doctorate.
Juris Doctorate.
Yeah.
I don't think I've had anybody ever refer to me in that fashion, however. Thank you, Mayor Demings, and good afternoon, everybody. Thanks to the vaccine and the many residents who are getting it as soon as possible when it is their turn, and next week it's just about everybody's turn, we have the opportunity to slowly and safely welcome back many events to our community, which I know people are highly anticipating. And as a city, we've been looking for ways to support our local arts groups and our community organizations and our entertainment venues to allow them to open and operate safely during these difficult times. And that's why I'm happy to announce that earlier this week, the City of Orlando partnered with Orlando Shakes, and through this collaboration, Orlando Shakes is moving its productions outside where it was originally born, which is the Lake Eola Amphitheater, to come together. So there will be performances. I think it started yesterday, actually, while we will make sure that they are safely, physically distancing and wearing masks, but it's an opportunity to experience live performances again. And speaking of events returning this weekend, we have the Spring Fiesta at Lake Eola Park. It'll be the 32nd year to showcase the beauty of springtime here in our park, where residents can mingle safely with artists and crafters and savor the flavors of vendors, from food vendors, and enjoy live entertainment for the whole family. So the Fiesta in the Park Committee has diligently worked to ensure the health and safety of patrons, staff, and artists by following all the CDC, State of Florida, and Health Department guidelines. The event area has been expanded significantly around the perimeter of the park. The flow of patrons is organized in a manner that people won't be in a free-for-all together. Face masks are going to be required. There'll be sanitation stations throughout the park, and each booth will also include hand sanitizer while being spaced out, as I mentioned, appropriately. As events slowly return to the downtown area, we remain committed to assisting businesses who have been impacted by the pandemic and to keep our economy moving. And last week at City Council, we approved a resolution to reduce the $250 delinquency penalty typically assessed for unpaid business tax invoices to zero for this year. And we hope that will help add a little bit of relief to some of those businesses as they continue to their path for recovery. Also, at that same council meeting, we added additional businesses approved under our downtown CRA Small Business Rental Assistance Program, which brings the total amount of businesses that have been approved to 49 for almost $1 million in funding. And as like Mayor Demings, I want to wish everyone in our community who is celebrating a happy Passover, and Easter, of course, is coming up on Sunday. So as you start your planning, always be mindful of our pandemic precautions. There are many ways to celebrate safely, and I encourage everyone to do that. Thank you, and Dr. Pina.
Thank you, Mayor. Good afternoon, everyone. So a few news to go over these. We continue to have this dichotomy of going very low in the older segment of the population that has been vaccinated, and a little bit of increase in the younger segment of the population that has not been vaccinated, and also very socially active. There has been a small increase in hospitalization, not much, 8 cases, but we watch every day. And ICU bed usage continue to be very low. Number of people in ventilators continue to be very low. But we also have seen an increase in the number of cases for school-age children per 100,000. So those are indications that it continues to be very active, the pandemic, within the younger segment of the population. Our recovery rate continues to be 96%, and we have seen a small increase in the 14 days rolling average positivity rate. Last time that we talked to you was 5.8. Today is at 6.1. That also corresponds with those numbers that we explained to you before. The number of deaths, as the mayor mentioned, has risen to 1,189. And those 7 additional deaths, 5 were female, 2 were male, 2 were black, 3 were other, and 1 was white. The ethnicity 4 Hispanic, 2 non-Hispanic, and 1 of unknown. And 6 have underlying conditions. Assisted living facilities continue to have very low cases. And I would like to highlight also that we have received another 23 additional variant cases reported to the state today. So our number right now is 105. And we have seen the UK, which continue to be the prominent of the variants in our county, Brazilian, and 2 from California. Fortunately, we have not seen yet the South African variant. Easter is coming, and people are going to congregate at home to have dinner. So please observe CDC guidelines if you are not vaccinated, and if the entire family is vaccinated, you can have a normal dinner if everyone has been 2 weeks after vaccination, after the second dose, because that's when you achieve the highest level of immunity. Also, on the vaccines, as the mayor mentioned, the Orange Convention Center's site reached 175, and our county yesterday reached 500,000. That's 500,000. Just to give you an idea how much we have speed up this process, in March, we have done 250,000. So half of the 500 were done in March. That's how much we have speed up the process. And it's also thanks to the opening of the Valencia site, which has doubled what we normally were doing. So as of today, we have 507,055 doses has been administered in our county. To our county residents, 449,227. For the percentage, people over 40 with complete doses are 167,567. That means 160,567 people in our county have done the entire vaccination. They really received both Moderna or Pfizer or one and Johnson & Johnson. That is significant. And for our residents, that is about 21% of the population over 40 in our county has been fully vaccinated. For the totals, residents of Orange County receiving at least one dose, 305,357, and that's a 21.5 of the entire population. When you just limit it to residents over 40, it is about 43.6% of the population. And for residents over 65, it's about 74% of the entire population in that age group have been vaccinated. With that, any questions that you may have, I will happily answer.
Okay, for questions, we do have Scott Howard here from the school district. We do have Tim Bodick with our compliance team, and Commissioner Maribel Gomez Cordero, and we do have Ms. Ilia Torres that can assist with Spanish translation if needed, and other staff here. If there are tough questions, I'll pivot to our other staff on the tough questions. All right, any questions?
Lauren Seabrook, Channel 9. My question's for Dr. Pino. And just want to ask one small clarification before I get to my question, because people are already asking on social media. When the portal opens tomorrow, will there actually be a drop down to say if you're 16 or over?
Yes.
Okay, perfect. And then I wondered if you could give us an update. You had mentioned last week, I believe, about your next step for expanding beyond what you can do at the convention center would be employer vaccination closed pods. Where are you guys at with that? Do you have any plans to start opening those anytime soon?
Well, all will depend on that upcoming increase on the number of vaccines that we are getting. We have requested additional vaccines. The state now created a system where you can pre-request what you are projecting to be needed. I think that's going to be a more efficient way of distribution to avoid getting, stockpiles in places and others not having it. So we have requested those additional vaccines. There are plenty of employers that we could work with and actually have existing MOUs with some of the largest employers in the area so that we can provide those services. So it comes to mind, the big ones, the Disney, the Universal, the SeaWorld, UCF, Lockheed Martin, and other companies that have large number of employees located in one location.
Amanda Dukes from Channel 2. This question's for you, Dr. Pino. Now that starting next week, we're essentially opening to almost the entire population, do you think we will start to see long waits to try to get an appointment? Are we going to experience a few weeks of sort of backlog as everyone is trying to get in?
So, yes, I think that we are going to at least the first 3 or 4 weeks, and we hope so, because that will indicate the appetite for the vaccine in a younger segment of the population. What we may have to get wise about, and we will watch, is our hours of operation may have to be modified a little bit to get adapted to the new segment of the population. Many of those individuals are, actively in the workforce, so we may have to do some adjustments to assess those needs.
Dr. Pino, this is Nikki Zizaza with News 6. I have a question for you. You had mentioned not too long ago that you guys have seen an increase in cases in elementary age students. What do you think is contributing to that? Is it spring break? Most recently, what are you attributing to that increase?
Well, I think it's a combination of factors. We cannot, ignore that spring break is happening, although many of the kids are not in that age, but we have seen an increase in that age group, not as much, but it had happened. Part of the issue is also that as we push we are pushing the pandemic into the younger segment by protecting the older. You know what I mean? So we are, although our numbers have decreased tremendously, we are talking proportionally. For example, remember there were weeks that we were having over 1,000 cases a week. And there were days that we have a significant number of cases in a day, over 1,000 a day. So with that to say, right now, today we're 515, I believe, the total number of cases. And I have to check that number. And what is happening, they are representing a larger proportion of the total number of cases. And that's the concern. People between the ages of 15 to 35 are probably over 50% of all new cases. And that's the concern.
Dr. Pino, I've got another question for you, sorry. My name is Joe Ficcarelli with News 13. You mentioned that the younger populations obviously are seeing more cases, and you also mentioned in the variants. There was research from Johns Hopkins that says the variants appear in the younger people, and it appears to have harsher effects on them, the variants. Are you seeing that as well, and are you seeing that in Orange County?
Any variants?
The variants being more with younger people and being harsher on younger people than the original.
So about the harshness and the effect, I don't have information. I will have to explore that. With regard to the numbers, we have all the ages, and they are a range, but it tends to be in the younger. And also what is interesting is most cases of the ones that have been reported to us, they don't have a history of trouble. So it indicates, if the information is truthful, that transmission of those variants is currently occurring locally.
It's Langston Reed with Fox 35. This is for Mayor Demings or Dr. Pino. And I just wanted to ask, have you seen people coming to get vaccinations at the sites under 40 in anticipation of the age limit dropping?
Yes, but we also have vaccinated, the mayor opened it up for police officers, storm law enforcement, clinical personnel, firefighters. So on those, we have seen all ages. We have not experienced people coming to try to squeeze in or anything like that in the youngest segment of the population. I don't have any information on that, so I don't think that had happened.
Okay. This is Melissa Thomas with Florida National News. Dr. Pino, you might as well stay up there. I think we all have our questions for you. But I wanted to get your personal thoughts on your takeaways on the recent town hall that you had done with Dr. Fauci and Congresswoman Demings, just kind of your major takeaways with that, and then would we be able to see something like that again in the future? That's something that's going to be more frequent in the future.
So about the frequency, I don't know. That's a question for her office. They are the one that organize it. And I have to be someone of that cloud to bring and to take 30 minutes of Dr. Fauci's time, I bet. The experience was amazing. The information that he provided was very actual and factual. We had a conversation. It was interesting because he educated me in some concerns very quickly. In the question that I have. And the question that I asked him was why we decided to go with 2 doses and not to do 1 dose to the entire population and then be concerned about the 2nd dose earlier. And from a practical point of view for us and the people who are doing the vaccination in the field, it gets confused, it gets tricky with the 2nd dose, and it slows down being able to give the first, because you have a volume that you can do a day, and then if any person that gets an appointment today automatically get an appointment for 3 weeks. So with that, it will diminish the number of people. And his take was quite interesting. He said, yes, that could have, and I'm paraphrasing right now, but basically what he said to that question was, yes, that could have been a strategy if we didn't have enough vaccines for everyone as a 2nd dose. But we have all the vaccines that we are going to need. So in that sense, he thought, and well thought, that it would be better to just have full vaccinated population, even if we go slower, because we have the ability to have all those vaccines available.
and Dr. Pino, I'll keep you back up there. I know you've said this week, both days now, we've had a lot of reports of new variant cases. I know on Monday you said they kind of date back to, I believe it was like Christmas Eve or something of last year. What has your office found in going through that data, and is there any sort of takeaway on how much of this is circulating around Orange County?
So I really don't know if the CDC has created. The CDC does create a lot of projecting models that you can enter data, and based on the population size and other factors could tell you how many you should have that you haven't seen that are, under the water kind of thing. But I don't know if they have done that for the variants. With regard to the symptomatology, is that what you asked about the other second? Yeah, today I was talking to Albina, and maybe she can come Monday with better data, because they are conducting some analytics right now on those cases and also another type of cases that we are following as well.
Dr. Pino, I'll keep these in a row, but this first one comes in from Peter Reinwald from News 13. Dr. Pino, do you consider the rise in Orange County variant cases significant? And please elaborate on any concerns. He's denoting there's 25 more since reported on Monday.
And, as I say from the beginning, it's probably more than what we have officially reported. There are many cases that go asymptomatic, or people don't report, or we don't catch it. That could happen. So 89, 105, the numbers are less significant as it is the presence of it. So it's happening. We should be very careful about this. We should increase our vaccination rates and to try to get to the younger segment of the population as quicker as we can so that we can prevent this. If vaccines volume gets available, you will see, at least in our case, a greater effort to concentrate in the younger population. Wherever they add, we will meet them. It could be a recreational facility. It could be at the schools if we can work with the Board of Education. It could be in many forms, but we are very concerned about vaccinating the youngest segment of the population as soon as we can.
And Dr. Pino, this one comes from Danielle Lama from Fox 35. Dr. Pino, what age group are you seeing the most vaccine hesitancy with?
Yeah, that's a question that I don't know how to answer because we haven't had all the groups. And it will be interesting to conduct some kind of survey online to see what kind of hesitation we find in our community. We have seen large volumes of people coming through it, and visually, and this is visually also, I'm talking to some of the people that come through, we have seen an increase in the number of minorities that are coming through the pot, so that's quite interesting, and we are pleased to see that because we have a concerted effort with the county, the fire department, and the federal government to try to reach our minority population as well.
And this last one is from Mayor Dyer. This one comes from Ryan Lynch in the Orlando Business Journal. Mayor Dyer, are there still funds available for the CRA Business Rent Assistance Program?
There are, so you can continue to make applications.
All right. Great. Mayor Dyer, anything else from you? All right. Well, thank you all for joining us today. This concludes this press briefing. We hope that you all have a wonderful Easter holiday weekend, and we will be back on Monday at 4:30 for the next press briefing.